keeps diminishing. 46% of people who live here are African American. That is almost double. And so we're going to talk about why that is. Okay, it's not because of genetics. You know, as Ms. Berry mentioned, I'm of Egyptian heritage. I talked to my extended family in Egypt, and interestingly enough, they're in Africa, where when we first heard about the pandemic, there were real fears that entire countries, entire villages, entire cities were going to be wiped out, and that's not happened. So we don't know exactly why that is, but if it was a genetic factor solely, we would expect that that would be translated among Africans. So clearly there's something different about why African Americans are dying in high proportion. And we really don't need to think about the genes. We just look to, why do African Americans die at higher rates? From cancer and diabetes and high blood pressure and just about every single illness. You know, when I was in medical school back in the early 80s, I remember the way that I would know a disease and how bad it was that it would disproportionately impact people of color and women. Then I knew that it's like, okay, this is how it almost always is. So why is that? I'm sure you've heard about the structural and social determinants of health. So where you're born, the zip code that you live in, your educational level, the food you eat, the air you breathe, the water you drink, that has actually more to do with how long you live than coming to see a doctor. Actually, that accounts for 80% of that predicts 80% of our life expectancy. If you want to know a shameful statistic, we live in Washington, D.C., the capital of arguably the richest country in the world. We're a 10-mile span. If you live in Georgetown, on average, you can expect to live 94 years. If you live in Anacostia, it's 66 and a half years. As far as I understand from my reading, that is the highest per capita difference in the country. And if you want to read more about this, you can go to a website, Uneven Opportunities, which was commissioned by the Kaiser Family Foundation and Virginia Commonwealth University. And all of these statistics, if you want to see about anything having to do with diabetes or high, I mean, it's the same disparities are there. That's why, you know, we didn't want to study disparities. We know what they are. It's what are we going to do about it? So with COVID, the highest risk factor that we now are learning about is actually being overweight, being chunky. So 83% of the deaths, people have been heavy. Diabetes is another really strong risk factor. And so I'm not talking about diabetes, which is well controlled. You can actually bring down your risk to the same as the general population if you control your diabetes. That's why getting people back into care and making sure that their diabetes and high blood pressure is controlled is so important. So the patient that I mentioned, the only patient that I've lost thus far, had diabetes, and his diabetes was way, way, way out of control. And he, you know, I tried for years to get him to go on treatment, and he declined. So diabetes, high blood pressure, there are some groups that are more at risk for some of the different aspects of COVID. So blood clots. Why do people get blood clots with COVID? Well, it's an inflammatory reaction. The body is just, you know, there's like something that they've never seen before. It's a foreign invader, so they're just reacting. And that can cause blood clotting. So you've heard about people getting strokes and heart attacks. You've heard about people having clots in their lungs. You've heard of people getting clots to their kidneys, even clots to their legs. I have a friend whose mother had to have part of her leg amputated because they have gangrene. You can also have, it's actually estimated that about 50% of people who have COVID, it impacts their heart. Not everybody has problems, long-lasting problems, but that's how sort of vicious the virus is. And why is it so vicious? It's because we have never seen it before. It's never circulated. It's a new virus. And what's very clever about this virus, it's kind of stealth. It goes in and it's not recognized by the body until it's too late. It's replicating, and then all of a sudden, you've got this inflammatory response. And in some patients, it's the inflammatory response that kills you. And of course, the virus itself can overwhelm the system. So you have strokes, and now this is what's different about what we've learned. And I'm just going to stop and say one thing. I'm giving you the best of information right now that we have. As information and science, and we get more information, that might change slightly, but this is the best that I have now. So you have, I told you about the blood clots, but now when somebody comes in with COVID, we measure their blood tests to see if they're at risk for a blood clot, and we can put them on a medication, whether it's aspirin or a blood thinner, to reduce that risk. That's why you're not hearing as much about strokes and heart attacks now, because we have now learned. Question about the chat in terms of blood transfusions. It's actually not blood transfusions that people get. It's a transfusion of a rich antibodies that people who've had COVID can produce these antibodies, so that when you're very, very sick with COVID, you can get some reinforcements for your immune system to help battle the infection.
We have one more question.
Yes, ma'am.
Someone wants to know, after having COVID, can one develop hives?
Hives? Yes, you can. So there are certain diseases which we call the great masqueraders, and that they can do anything. COVID is one, HIV is one, lupus is one, TB is one, sarcoidosis is one. So it can do just about anything. It can affect your skin. Keep focusing. They can feel very, very tired. They can feel depressed. I mean, you've seen, and somehow it seems to affect women more than men. And maybe because women's blood vessels are a little bit smaller, we're not sure. Is one theory. So COVID can have a whole host of manifestations. And so what I want to say is that, yes, we've done better with the death rates because we're learning how to treat it and control it better. But people forget about disability, right? That you can be disabled. I mean, the lady that lost part of her leg is not going to be able to walk properly. If you lose part of your lung function, you don't get that back. Or if you lose part of your heart function, or if you have a stroke. So, in Egypt, people are like, well, if it's my turn to die, I'll die. But I always tell people and patients, there are actually worse things than death, if you think about it, right? In my mind, I mean, if I die suddenly, that's horrible for my family, but I'm not suffering. But to me, losing my independence and having disability and having people having to take care of me, that is very tough for me. I mean, not that I have a choice in it, but so I think that's another part of the conversation, that doesn't enough attention. People are, oh, you're going to die. And so, I mean, especially for the younger people, it's like, okay, I'm going to die anyway. They've got that, that's not an unusual thing for young people to say. And when you look at who's not getting vaccinated, it's the 18 to 40-year-olds, and that's across the board. More so in communities of color. And so this is an issue. In Washington, D.C., we're now 7th in the country with per capita deaths among African Americans. This is hitting our community very hard. There's a group that actually has higher rates of deaths than African Americans, and that's Asian Pacific Islanders, followed by Native Americans, followed by African Americans. But because the population of African Americans is so much higher, 13% of the country and growing, that's why there are so many more deaths in terms of absolute numbers. So before I leave sort of what COVID does, I just want to stop and see before we talk into sort of the treatment. Any questions about what COVID can and cannot do as far as we know? Okay, so hearing none, we'll talk about treatments. As I mentioned to you, a lot has changed in our knowledge. I mean, unfortunately, we learned a lot from the Italians and the Spanish and also from New York. So when we had our surge here in Washington, D.C., which was in May, we had some idea of how to treat people. So initially, they were putting everybody on respirators. We stopped doing that. We actually try to treat them with like oxygen. For any of you that have sleep apnea, you have these CPAP machines. We use something called BiPAP, which uses pressure to get oxygen into the lungs. You're not on a respirator. We also know that you have people sleep on their belly because that you get more oxygen than if you sleep on your back. We also know that there are steroids, prednisone. Actually, when people are, they come in, we measure their blood tests and they're very high inflammatory markers. We put them on steroids. That's been life-saving. Some of these other things like the hydroxyquinone that the former president, by the way, just to tell you another Egyptian thing, my grandmother, when we used to talk about cancer, she would never say the word. She would say that disease that shall not be named. And so with the ex-president, I say the person whose name shall not be given, because we feel that when you name something, you give it more power, right? And anyway, so there are lots of there was actually another treatment that people spoke about, which is for parasites, ivermectin, I believe, and that's just been proven not to work. The plasma infusion that we just mentioned works. It does help. So it's really about identifying those people that are at risk for dying, and those are the people that mount that very robust inflammatory response, and making sure that they get treated early and right away. They get put on steroids, they get a blood thinner, okay, and then they get the plasma, because not everybody gets offered these treatments, right? And I've had a couple of people, including one of Ms. Berry's friends, who was being taken care of in an outside hospital. Of course, she's Black, so she doesn't get good care. So we actually transferred her to GW so I could keep a watch on her, and so she could get all the treatments. And we know, people talk about historically, there's a distrust in the African American community because of Tuskegee and, Henrietta Lacks. And I always correct people and I say it's historical, but it's ongoing. Dr. Susan Moore, who you probably read about, or you may have even seen her video, which was heartbreaking, actually graduated from my medical school, University of Michigan, back in 2003. She was the one that documented how she was begging for something for pain and could not breathe. And finally she died of COVID. So this is not in the past, it's in the right now. So we talked about the treatments, we talked about how COVID impacts, we talked a little bit about risk factors, but you work with people who are at high risk, whether it's because of being overweight, diabetes, high blood pressure, but also people who have depressed immune systems. So people who are HIV positive, people who are on dialysis, people who have multiple sclerosis or lupus or any disease that by itself depresses the immune system. But all these medications that you see advertised on TV, that says this is for psoriasis or for Crohn's or for any other host of diseases, those suppress your immune system. Sickle cell disease, people with asthma. I mean, I could go on and on and on, but if you go to the Black Coalition Against COVID.org, and I'm going to ask Ms. Beans to pull that up just so that you can see a whole host of diseases. So basically, everybody is at risk, because even if you're young and otherwise healthy, if you catch COVID, you could have the COVID long hauler syndrome, and you can actually get reinfected with COVID. That's why vaccinations are so important. Ms. Beans, can you pull that up, please? Thank you. And actually, maybe now is the time to show that love letter. How about that? That'll give us a nice break, so I'm not always talking. Let's show that. Thank you.
Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. We urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. But tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/love letter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
Thank you for showing that. There's a lot more information on there. This was actually a video that, or a love letter that we did back in November around Thanksgiving. And that's why they talk about the vaccine as something in the future. So now let's talk about the vaccines. There are three types. There is the Moderna, there is the Pfizer. Those were the ones that were initially available, and these are 2 shots. And then there's the Johnson and Johnson that just became recently available, and it's 1 shot. And that's the one that we're going to be, that the city is giving us. So let's talk about the advantages, the disadvantages, but some of the myths around each of those. So as you heard from the very first video that we showed, I think that there was a lot of concern about the rapidity of these vaccines being developed, especially in an environment of high distrust with the previous administration, and because they are so profit motivated and everything that they had said. But just as the first video showed, the technology of mRNA is one that's at least 12 years old, and it's been used. The advantage or the disadvantage of the Moderna and the COVID is that it has to be stored in ultra cold temperatures. So if we had a rural community, for example, you would have to assure that you would have a storage for that, or you could bring it from another place, but you would have only a 6-hour window to administer it. Because once the 6 hours are over, you have to get rid of the vaccine. So that's why you see people giving away vaccines at the end of the day, because nobody wants to waste them. And so there are actually a lot of young white kids that just wait outside the Giant, right? And if there's any vaccine, they're very good at knowing exactly where to get the vaccine. So that's number one. There's a lot of hesitation around the mRNA, and people have said, well, is this a way that we can get followed? Is this going to change our genetic makeup? And what I tell people about being followed and monitored, we're already followed and monitored. in everything that we do. If you've ever looked something up on your computer, and then the next thing you're getting is advertising on whatever topic, you know, it was that you looked up. If you're looking and researching sleep, and all of a sudden you get, you know, ads that are all about sleep, then we are being followed. There's no question. We are being monitored in every way imaginable, and probably in ways that we don't even know. The mRNA question is a valid question. Does getting injected with that change your DNA? I can't give you a solid answer because I don't know. I don't believe that we do because I've taken the Pfizer. My parents have gotten the Moderna. I think that, you know, when I'm 61, you're my age or people are older, I think that people are like, okay, I don't want to die from this. And I only have, you know, 20, 30 years. It's not going to be as big of an impact. That's not much of a worry. But for younger people, certainly we don't have the vaccines opened up to children yet. Right now it's 16 and above. The Johnson & Johnson is 18 and above. That's a consideration, especially for women who are thinking about getting pregnant or who are pregnant. And so I can't tell you for sure that the mRNA is not going to impact. I don't think it is because it's not, you know, it's using the mRNA of the spike protein, which sits on this kind of spiky ball that is the COVID. And so that is what gets injected so that you can build an immune response. But I can't say. And so as you see, I'm only going to say the things that I'm, you know, sure of or certain of or have the data to back it up. The side effects of all the vaccines are the same, and I'll come back to that. Johnson & Johnson, the advantage is that it's one shot. You don't have to double back and get a second vaccine. It's also using the same technology that we have with the flu shot. And so these vaccines have been around for decades and decades. I think that brings comfort to people that this is not a new technology. There's nothing live that's used, no mRNA technology. It's the same technology that we use with all the other vaccines. There is some theoretical advantage that it may actually provide a broader protection for these new strains, because actually in point of fact, it seems to do better against these mutations. And it may be because it's not, this is theoretical, this is me just, you know, theorizing, that because the Moderna and the Pfizer just are against this one spike protein, where the other one is against the whole virus, then it has sort of a better ability to detect viruses, even if they're slightly changed. It seems to do better. But what you've heard that's been really confusing, and I wish they would do a public education campaign, is that the efficacy of Johnson & Johnson is less than the Moderna and Pfizer. So that's caused a lot of discussion, especially among, you know, the African-American community and other communities who've always gotten things that are second best or not as good. Is this a watered down vaccine? And the answer is no, it's a completely different vaccine. And I tell people, in the way that matters, in that it reduces death and disability at the same rate as the Pfizer and the Moderna. So it is just as effective, that's the word, effective versus efficacious, as the other vaccines. They're all equally effective at reducing death and disability. People who've gotten the flu vaccine may have experienced this, that, you know, it doesn't protect 100% against getting the flu. And that's why we vaccinate people, is because, and these vaccines are much, much more effective. With the flu vaccine, we cover about 40% of the strains that are circulating. That's if we're lucky. So you see a lot of people that get sick, but hopefully with the flu vaccine, you reduce the deaths. Now with the COVID vaccines, we know that the deaths with all three of them go down and are, I don't want to say eliminated completely, but death and disability is substantially reduced. So we'll talk about the side effects, and then I'll stop talking because I want to make sure that we have enough time to answer your questions. So the side effects, if you're over 55, you don't really feel a whole lot other than a sore arm, okay, and tired. So I tell people to try to time the vaccines like on a Friday or on a weekend so that you can rest if you are working outside the home. For the other ones, the younger you are, the more robust your reaction is. The two-parter in particular. The first vaccine, people don't really see a lot or feel a lot, but it's usually the second shot when the immune system has been primed and they get the second vaccine. And it's like all of a sudden the immune system is on high alert. It's like, oh, there's something that's not right. We're going to go and attack it. So that's when you can have the fevers, the shaking chills, the fatigue, the muscle aches. Some people have more GI upset. Some people even have diarrhea or nausea or even abdominal pain. You certainly get redness at the site. I get a lot of calls about, oh my God, my arm is red. It's like, don't worry, that's part of the reaction. But in my experience and in the reporting and research, those side effects last for roughly 24 to 48 hours, but certainly no more than 72 hours. And I will just say one thing, that some of the people that we vaccinate, even though we have done temperature checks, we've asked them about symptoms, may have had COVID already. I mean, ideally, if this was something that we had a good test, a good rapid test, which we don't, we've got good tests that take 48 hours, 72 hours, but the rapid tests, as you saw in the White House in the former administration, obviously it wasn't working because they would have these parties and they were COVID parties and they would all get infected and they were using these rapid tests. Right now, the technology for these rapid tests or home tests are not that great. You know, you've got about a 30% miss rate. But ideally, if we could, we would check that before people got vaccinated to say, uh-oh, you actually already have COVID. So we do vaccinate people after they've had COVID, but we have to wait about 2 weeks until after all of their symptoms are gone. So I'm going to stop there. I see that there are a couple of, okay, so there's
A couple of questions.
Ms. Bookard asked, could you share insight on the ingredients in the vaccine? I was surprised by the question if I had any allergies to oral laxatives when I took my first vaccine. Okay, great question. So this is the Moderna and the Pfizer. They were seeing allergic reactions, not dramatic ones, but like skin rashes. And they isolated the preservative. It's the same preservative for any of us that have had the pleasure of getting a colonoscopy that they use to prep your bowels. So that's why you were asked that question. The Johnson & Johnson that's not an issue. And actually now the newer Moderna and Pfizer, they've actually eliminated that because it was causing some reactions. Oh, speaking of reactions, I get this question a lot. I've got allergies or I've got asthma. Does that put me at higher risk for having a side effect? And what I tell people is if you have had a reaction to a vaccine where your face or tongue swells or you can't breathe, then you shouldn't get the vaccine. So it's only a reaction to vaccines. But if you've had even those dramatic side effects or reactions rather to food or medications, you can still get the vaccine. Ms. Beans, would you like to ask those 3 questions, please? Oh, before I go on, did that answer your question, Ms. Kim?
Yes, partly. And if you can share, if there are any other ingredients that you know that are in that vaccine?
Well, there are the preservative ingredients, very similar to the ones that are used in the flu vaccine. So those are the ones that I'm aware of. I don't know, I don't have the rundown on all of them, but those are the ones that were problematic for some people. And as I say, they were like a rash, that kind of thing. But nobody died of that reaction.
Thank you, Doctor.
You're welcome, of course.
So we have the first question is, if you have never taken any form of vaccine as an adult, example, pneumonia, flu, shingles, can taking the COVID vaccine bring on any other diseases? That's the first question.
Great question. And the answer is no. Probably as an adult, you've had a tetanus vaccine though. Certainly women who've have been pregnant, it's required to get a tetanus vaccine. So women in the childbearing age. And then if you've ever cut yourself or gone to the emergency department because you stepped on a nail, you'll get a tetanus vaccine. So a lot more people have gotten vaccinated as adults than they realize with the tetanus. But great question. And the answer is no. But remember, no as of right now. One of the good things about the requirements for vaccinations, by the way, the requirements for vaccinations from the standpoint of monitoring are probably the strictest requirements more than any medication. So the vaccine, there's a vaccine board. So any side effect must legally be reported. There's even a vaccine fund, so that if somebody gets a side effect from a vaccine, this fund actually pays for the care of the person. So that's why they're so good at keeping track of any side effects, so that they can, if somebody comes 20 years later and said, look, I became disabled, they can say, well, according to the vaccine monitoring, this was never something that you reported. You just developed this problem last week. Did that answer the question?
I think so.
Yes, it did. Thank you.
Oh, sure.
And then the next question is, if you experienced a severe reaction to the flu shot, should you take the vaccine? And their reaction specifically to the flu shot was throat, eyes, and lips were swollen.
They should not be getting the vaccine. That is exactly the type of person that should not get the vaccine. Okay, because they had exactly that kind of a reaction: tongue swelling, throat swelling, face swelling, inability to breathe. You should not get the vaccine. You should speak to your doctor or clinician to see if there are alternatives. But no, you should be vigilant with the masks. And now the masks, because of these mutant strains that are circulating, a single mask is not enough. It's the double mask. And by the way, we actually distributed 560,000 of those new masks and hand sanitizers in Southeast, and Ms. Berry will be giving them out on the day of the event.
And then we have one more question in the chat, and then we'll follow up.
Did that answer the question? Great. Okay, great.
And then one more in the chat, and then we'll follow up with Derek Phillips's question. So I guess this question for you, Dr. Elbeyoume, is kind of like yesterday. They referenced the Tuskegee experiment, and now we're in COVID, right?
Yes,
and they're saying Johnson & Johnson and the baby powder, we're all familiar with that, and the chemicals. So basically their question is around, please clarify if I'm not getting your question right. Their question is around if you know the connection between the Tuskegee experiment and the COVID vaccine now, and then if you can speak more about the distrust with Johnson & Johnson.
Yeah, I mean, like I said, the medical apartheid system is alive and kicking, right? And so there's reasons to have that distrust. It's not like, they say, oh, you're so conspiratorial. Well, they're conspiracies because they're true. Yesterday, I talked about the smallpox. The first instance of biological warfare was perpetuated by white Americans. They gave the Native Americans knowingly infected smallpox infected blankets and wiped out a whole bunch of people because they had never seen smallpox. It was kind of the COVID at the time, wiped them out. So that's not a conspiracy, that is truth. How Black people and others get treated when they go to the emergency department, that's truth. That's not conspiracy. The opioid epidemic, that's a very fresh one that was really disgusting, because you had a pharmaceutical company buy off a doctor who wormed his way into one of the FDA advisory boards, and all of a sudden started talking about pain. Pain, pain, pain. We got to eradicate pain. They made pain the fifth vital sign. So when you check the blood pressure, the temperature, the pulse, the weight, that became something that was required by hospitals. You would lose your accreditation if you did not measure the pain and treat the pain. And these people were making money hand over fist. And then when it turned out that this was a problem, they came up with the treatment for that opioid addiction. They got you coming and going, money. And actually this whole thing about pain, and then I'll switch, but I think it's an important lesson. What these pain medications that were being given before surgery, during surgery, all of that actually were increasing dependence. When you don't do that, people don't need as much. So yes, that is a conspiracy, which is all about profit, which is true. So we have to have that in our mind. But here's something else that I would say. The people that are dying are an essential part of the workforce. So if we look at what this country was founded on, which is the three-legged stool of violence, racism, and greed, okay? The system has to be careful that you don't kill off people that are essential, right? So, and furthermore, what I tell people, look who's standing in line. Look who comes to the giant and kicks up a fuss about wanting to get the vaccine. And you have to even get security guards. But that notwithstanding, these are profit motivated, what do you call it? Entities, corporations. But somebody like Johnson and Johnson is probably much more careful than anybody else because they have that bad reputation. And that's why also I showed you that very first video so that you can see who is involved in actually not just making the vaccine, but also the oversight. Not to say that just because you're Black, that's going to guarantee anything. We know Ben Carson, Clarence Thomas. There are a lot of people that are Black that don't necessarily rep, right? Am I right? And the sad thing is Ben Carson is from my alma mater too, from Michigan. And when he first, I mean, we all watched the Gifted Hands, and now it's like we feel so badly that he has just shamed us. He should have his Black card revoked. He is just such a shame. He's so, anyway, but I digress. So I think that's why the oversight is so very important. That's why diversity in everything that we do, not just in race, but in class and professions, is so important. So you've got different people with different lenses that are on these data monitoring boards. That you've got Dr. Kizzy Corbett, who is 34 years old, young woman, PhD, virologist, who was one of the leaders in the development of the Moderna vaccine at the NIH. I mean, yes, to some degree, we have to take a leap of faith. I mean, all of us. I mean, we make these decisions on a daily basis. And what I come back to is that as somebody who's had cancer twice, and I've had all the genetic testing, it's negative, there's no family history, well, then there's something that I'm eating, right, or doing and ingesting, on a daily basis. I'm a potato chip lover, for example, barbecue and sour cream. And it turns out that potato chips are cancer causing. I mean, really. And so there's, not to be dismissive, I just want to be clear, I'm not being dismissive of the concern, because when something is new, we take a much closer look at it. But we are also, there's a lot of other things that we're not scrutinizing as closely as we should, right? Because we take a much larger volume of that than a vaccine. I hope that I answered that question. Did that answer the question?
I believe so.
I have a tendency to go on and on, so stop me. There's all these side comments, and if you think I'm bad, you should meet my parents.
I'll check with that person to see if you answered their question. And then Derek Filson had a question.
Yes, hi.
Hi.
I had a question related to my statement, Doctor. I think back, thinking about this coronavirus. I think back 35 years ago when I was pregnant with my oldest daughter. Well, not pregnant with her, but when my daughter was born in the hospital, I remember like putting on a mask and gloves and this back with little jacket and all this protection that day. And my thoughts is there was so much protection because to protect her and her mom and all these things. You think that once everybody get vaccine, whoever need to get vaccine, there should be more emphasis put on the continuance of protection. I haven't heard that as much as getting the vaccine and versus continue to being safe.
Thank you so much, because that is an essential element. I think that one of the fears that you probably have heard Dr. Fauci talk about is exactly that people get complacent. There are these circulating viruses. I know somebody who got one of the physicians, she was in a clinical trial, got the Moderna vaccine, had blood tests to show that she had antibodies, and then got COVID. I mean, she's fine. She was kind of down for the count and had to be quarantined because she's a doctor. But that really speaks to your point that we have to be vigilant in terms of protecting ourselves. We could actually take a page from our East Asian sisters and brothers. People make fun of the Koreans and the Japanese and the Chinese for wearing those masks. Well, they had the right idea, right? And it's not just for somebody says, well, it's pollution. Well, no, it's also because they get protected from, things like the flu. Like this year, we've hardly seen any flu because everybody's masked up.
Right.
So your point is very important. One of the things that's my pet peeve, and I don't want to insult any group of people, but the hand washing after using the restroom in public bathrooms, I'm shocked at how some people don't wash their hands. I'm not going to say who, but these sort of basic hygienic practices, when we come home, we're supposed to wash our hands. I always wash my face too. I also keep my nails because dirt can come under there. We have, again, this is in Egypt. My grandmother would make us, there's brushes that you can brush, really well and get all the dirt if you're not going to keep your nails short. There are hygienic practices that are some parts of the religious based, and I'm born a Muslim, but, you have to, pray 5 times a day and you clean and so forth. So hygienic practices, and even in terms of food, like one of the things that I know that I'm not part of the African diaspora, but the African diaspora does, is the cleaning of things like chicken and fish. We clean them, with vinegar, with flour, you clean them, those, and sadly, these kinds of habits are dying out, right? Because you don't have the generational sharing, but there's and then if you look to sort of white Europeans, they don't do that. So hygienic practices in general, but specific to your question in COVID, okay, and beyond with other infections. I mean, COVID is one, but there are other viruses that are coming.
And then I have another question.
Wait, excuse me. Did I answer your question?
Yes, ma'am.
Okay. Sorry about that, Ms.
No, sorry about that. And then I have a follow-up question. Do you have an idea of the representation or the percentage of representation of people of color that have participated in these studies? And
yes.
These studies are as it relates to COVID.
Yes, almost 13%. That's the one thing that was done very, very well, is that they were very close to matching the population. Really important question. And that's why the Black Coalition Against COVID and others really made a deliberate effort to engage as a diverse patient population as possible. And same with the children. There are now clinical trials involving kids. So hopefully by the summertime, we will be able to, to get kids vaccinated. I will tell you that thankfully, I sit on the Children's Advisory Board for Community Advisory Board for Children's Hospital. And we've been very lucky so far that even though there have been deaths among children, there have not been near the amount with adults. But these new strains, unfortunately, the South Africa, the British, the Brazilian, actually we're seeing more deaths among kids. So we really have to be, vigilant. To your point, Mr. I can't read, I'm so old, Mr. Filson. And these Zoom things, I mean, they need to have a version for people older than a certain age so that you can, make make the lettering bigger. I can't see. And these are new glasses. Yes, Ms. Beans.
And then I have one more question in the chat. These vaccines were approved in such a short time. Does anyone know what the long-term health problems can be?
Sure. So one of the things that is important to recognize is that the time that it takes to authorize any treatment, a device, or a vaccine or medication depends on how many people are enrolled in the clinical trials. So if you have 100 people that are enrolled in a trial to test a new medication, it's probably going to take decades before it's approved, because you need a lot of information to see. Because it could be that you chose those 100 people and nobody developed side effects, not because there aren't any side effects or problems with that treatment or vaccine, but you just didn't, you just was luck of the draw and you didn't test it in enough people. The thing about these trials and why it seems like it happened quickly, and it did, is because you had tens of thousands of people that were enrolled in clinical trials. So that comes to the concept that we use in research, which is the power. The power of the studies are very, very high. So tens of thousands of people. So you don't need as much time. So the time frame is shorter, because if you've got like 100,000 people and you're testing something, the possibility of there being a real problem will be unmasked versus 100 people. The other thing is, because I got this question yesterday, which is with the vaccine, people wanted to wait out and see what the side effects would be. And I said, that's exactly how I felt. So I was kind of glad that the British were the first people that were testing it out. But now we've got millions and millions and millions of people who have been vaccinated. And so the safety of this vaccine is actually safer than almost all the other vaccines. What the long-term implications are, I think I alluded to that when we were talking about the mRNA. I don't know. I just don't know. I think that I will hypothesize that the Johnson & Johnson maybe will. I don't believe that there'll be the long-term side effects, but I don't know with those two other vaccines because their technology is 12 years old. I don't think so. As of 12 years of data, doesn't seem to be. But when you're talking about, children, for example, or young adults or people that are going to live, another 80 years, 100 years, you're going to be a lot more careful. Same with pregnant women. And I theoretically feel, this is my opinion, this is not science, but I feel that that's why I would prefer Johnson & Johnson in those settings. That's just my personal feeling, not backed up by science, but my feeling. Does that answer the question? So the bottom line is we don't know.
They said yes, they answered the question.
Great.
And I have two additional questions. One person wants to know, actually this can be two questions in one. Has anyone died from the vaccine? And then can you speak a little bit about, or how can we find the data on the studies that were done?
Excellent questions. So the data is publicly available, I want to say, on the FDA website. Maybe Ms. Beans, if you could look that up while we're talking. I believe so. So the people that have died from the vaccine, and of course you hear a lot of stuff on social media and the internet, have been less than in any other vaccine. And it's because of the allergy that, that was mentioned earlier, that they've removed that particular preservative, or for the person that had the severe side effect to the flu vaccine, that they inadvertently got vaccinated without knowing that they, had tongue and throat swelling or severe shortness of breath. There, you may have heard that AstraZeneca, which is the vaccine that they're using in, can you hold on one second? This may be a physician I'm trying to reach. Hello? Oh, thank you so much. I'm actually in the midst of giving a webinar. Is it possible for you to call me in like 20 minutes, half an hour? Thank you so much. Really appreciate it. Thanks, bye. I'm sorry, one of my best friend's son was suicidal and homicidal, and this was his psychiatrist, so I had to take that call, forgive me. So the publicly available data, and so I was talking to you about AstraZeneca, which you've probably heard about or read about. This is the vaccine that they give in Europe, and they have had blood clots that have been associated with that. But when they compared the number of blood clots in the general population, it was actually not higher. But many countries have decided that they don't want to use that particular vaccine. But again, remember, and this is very difficult to sort out, there are some people that are getting vaccinated that probably had COVID. And I told you that COVID is associated with clots anyway. But in general, these vaccines are exceedingly safe and safer than most of the vaccines that we get kind of routinely. Did you find anything, Ms. Beans, on the FDA website?
Yeah, I posted it. Oh, I found a little bit of information, so I'm looking through it now. I've posted what I found so far in the chat.
Okay, all right. If you don't find a good information, please email me also about the people who want to get vaccinated prior to the event, and then I can take that to my colleagues in infectious disease and get an answer by Friday.
I'm sorry, you broke up for a second. Could you repeat that?
No, if you would just send me that question, whether it's the FDA or people getting vaccinated prior to the event, I can get the answer to you by Friday.
Perfect, thank you.
Sure. Other questions?
Okay, I have another question in the chat. If I haven't received the vaccine, how in good faith do I tell someone to get it?
So that's actually came up the last time. So we're trying to see if we can, for people who are interested, to get the vaccine ahead of the April 3rd event. That's exactly what we're going to look into. And what I tell my patients, and it does make a difference that I've taken the vaccine and that my parents have taken the vaccine. So if you haven't personally, but let's say you have a loved one that has, like an older, parent, then that's another way that you can have credibility. But we're trying to make the vaccines available to you prior to the April 3rd event for exactly that reason. Other questions?
This isn't in the chat, but could you touch on, I think we touched on it a little bit yesterday. I know some folk had some thoughts around being injected with like the live virus. Why am I going to get injected with the live virus? Could you touch on that?
Being infected with live viruses, that is, not true. And actually the very first video that we showed spoke to that. Nobody's getting injected with live virus. The Johnson & Johnson is dead virus, just like with all the other, technologies and other vaccines that we get. There's nothing living about it. The mRNA of the first two vaccines, the Moderna and the Pfizer, it's an mRNA to just the spike protein so that it can induce a reaction. So there's no whole virus that's being injected. There are live vaccines that we give. Polio is one of them. Okay. Yellow fever, which we don't use unless you're traveling abroad. So those are the two vaccines that pregnant women, for example, cannot get, nor can they anybody who's immune compromised. And before the new shingles vaccine, we could not give the shingles vaccine because that was a live virus vaccine. But now the new shingles vaccine is not, it's dead virus. So yeah, so the yellow fever, oral polio, which kids get vaccinated with, and that's been going on for years and years, and has helped to, you know, eradicate, if not eliminate quite yet, polio. That's an example of a live virus. This is not. Did that answer the question, Ms. Beans?
Did they answer your? Oh, yes. Okay. And then I have two more questions. The first question is, can you still get the virus after you receive the vaccine?
It depends on which vaccine. It's less likely with the Moderna and the Pfizer. There's still a possibility. I mean, if you saw that very first graph in the Mr. Bell's video, you will see that after people have been vaccinated versus the ones that have not gotten vaccinated, the ones that don't get vaccinated, it's a very high curve. The ones that get vaccinated, there's still some, but it's at a much lower level. And again, no deaths or disability. That's, to me, the most important point. I mean, not that you want to get sick with anything, but to have a mild kind of like cold type thing where you're not dying, right, or disabled or landing in the hospital versus just a minor cold where you may be out for like a day or two is very different. So yes, you could potentially still get infected, and just like with these other foreign strains, right, or mutant strains rather, that we've talked about. But one of the other things that you should know is the vaccines. One of the main ways that we transmit them is actually through our nose, and so the viral shedding that happens after you've been vaccinated almost completely disappears. So you become much less infectious to other, and in terms of potentially transmitting to others. Did that answer the question?
They said yes. And then you also answered the last question that I had in the chat.
All right. Well, it was a pleasure meeting all of you. I look forward to seeing you at the April 3rd event. And one of the things that Ms. Beans and I were talking about before the call is that I really want to be able to introduce you to the other people that need your expertise and experience, that are trying to really help people across the city. So we can talk about this maybe after even before our April 3rd event, and we can do a little webinar just like as an intro to other groups that are going to be present, because I just think that this is a powerful group of people right here on this call. So all righty, thank you everybody.
And I'm sorry.
Oh yes.
Can you get both shots? If so, how far apart?
It depends on the shot. The Moderna, you need a full month separated. For the Pfizer, it's 3 weeks. And people get nervous if it's more than that in terms of the recommended. It's like 6 weeks at the very, you know, the span. You want to get it for the Pfizer between 3 and 6 weeks. I think the Moderna is 4 to 8 weeks, I believe. But please look that up. But yeah, that's the time frame.
I'm sorry, I asked that question. I guess I wanted to know, can you get the Johnson & Johnson also with so like say for instance, you got the Pfizer, then can you get them shots? Can you get both?
No, because the Johnson & Johnson is just one shot. I understand. If you got a Pfizer, can you follow it up with a Johnson & Johnson? The answer is no, because of vaccine supply. But you know, if the person got the Johnson & Johnson after the first dose of Pfizer, they won't be hurt by it. I don't know how protected, well, I think they'll be protected. So I understand what you're asking. And that's the best way that I can answer it, if you understand what I mean.
Perfect. Well, thank you so much, Dr. El-Bayoumé, for this wonderful second session. Staff, thank you guys for attending today. Feel free to pop into the session on Friday if you have any additional questions. Like I said, feel free to join on Friday, call, text, or email me any additional questions, comments, concerns, and I will filter them up to Dr. El-Bayoumé. Again, we're looking at having this pop-up vaccine event the first weekend in April. Really looking to get 1,000 Ward 8 residents vaccinated with the Johnson & Johnson, as well as to provide wraparound services in the forms of mental health support, the blood pressure cuffs and monitors, food support and things like that. And so I think this is the first step in really just showing our commitment to the community as it relates to doing our part to reopen and get back to being able to touch lives and families. So thank you guys so much.
Thank you. And thank you, Ms. Kim. I appreciate the shout out. And thank you everybody for your time and attention, and look forward to seeing you. Thank you. Okay, take care. Bye-bye. Bye-bye. Off to clinic.